Hey, good afternoon, everyone. It's Mike Casamassa with Henry Schein. We are going to delay about 1 minute before we get started, just give everyone an opportunity to get on into the system. And we look forward to starting here shortly. Thank you. All right, good afternoon, everyone. It's Mike Casamassa. I'm the Vice President of Solutions for Henry Schein. We are right at the 2:30 mark Eastern Standard Time, so we're going to go ahead and get started. Hopefully this will give people an opportunity to get on in and get settled. But we are incredibly excited to welcome you to the fourth webinar in our series called Reimagining Care Delivery. Today's webinar is based on remote patient monitoring, specifically how you can keep your patients healthy in between visits using RPM and also getting reimbursed for it. So this should be a really practical webinar today to show you how you can hopefully improve the clinical outcomes of your patient population and also make some money doing it. We're very fortunate today to be joined by Jeff Stern, who's a vice president with Carium. We selected Jeff and also Carium to present today because of a number of reasons. First and foremost, Jeff is an expert in remote patient monitoring, and the Carium platform is really simplistic and intuitive. And in our experience, success in remote patient monitoring really hinges upon those factors. You're going to find that that you all do a lot of work, or in general, practices do a lot of work in between visits. They do a lot of things that oftentimes aren't reimbursed. And today is really to try to give you those things that you need to be aware of so that you can actually make money for the services that you're rendering. So we hope that you find this, this webinar useful. We hope that it will be applicable to you and that you can certainly get started. And then on top of that, if there is an opportunity, if you would like further information, not only is Henry Schein available through your regular field sales consultant or telesales consultant, but Jeff will also be available to answer questions too. As we go through this webinar, there is an ask questions feature that you can certainly post a question. At the end, both Jeff and I will come back on and we'll answer any questions that you may have. And with that being said, I just want to say thank you for attending. We'll look forward to your questions. And now I'd like to turn it over to Jeff Stern.
Hey, thanks, Michael, for the great introduction, and thank all of you that are in attendance for taking time out of your busy schedules to be with us this afternoon. And let me just start by saying how honored Carium is to be selected to be a part of this webinar series, but more importantly, has been selected to be one of the vendors represented in Henry Schein's Solutions Hub. So my goal today is really to focus on remote patient monitoring and how Carium can help you generate an additional revenue stream while providing the same quality of care to your patients at home as they have come to expect when they come into your office. I'm also going to spend some time showing you a brief demonstration of our solution, and then obviously we'll save time at the end for questions and answers. At the end of the presentation, if you're interested in learning more about Carium and how we can assist your specific office, I would encourage you to reach out to your Henry Schein representative. So let's go ahead and get started. Well, it's obviously no secret that healthcare has changed pretty dramatically over the past 15, 16 months. Patients aren't coming into the office as much as they once were, and it's really causing provider organizations to have to adapt. They're having to adapt to, how do I continue to care for my patients when they're not coming into the office? How do I continue to recruit new patients in this new landscape? And then most importantly, how do I continue to generate revenue where in many cases, especially for our primary care offices, is down up to 80%? One of the best ways that we can do that right now is through a program called Remote Patient Monitoring. And the program has actually been around since 2018. But similar to televisits, it really didn't see the light of day until this pandemic hit. The program is pretty simple. You provide your patient some type of Bluetooth or cellular enabled connected device, whether that be a blood pressure cuff, a scale, a glucometer. The patient takes that device home and submits 16 readings in a 30-day period from that device. The care team at your practice spends 20 minutes reviewing that information and intervening when necessary. And I say care team because this is not something that has to be done by the physician. It is typically a medical assistant, a health coach, or a care manager that is monitoring these patients. For those two things, CMS reimburses $123 per member per month. That does not include the $21 setup and education fee that you receive, or for each additional 20 minutes that you spend, there's an additional $42 in reimbursement available, up to 90 minutes. So just to give you a sense of what this means to a provider's bottom line, we took an average patient panel size for a primary care office of about 2,500 patients. We went ultra conservative at 10% would be Medicare and would opt into the program. That leaves us 250 patients per month participating in remote patient monitoring. That would generate an additional $25,000 in recurring revenue per month per provider. And this number is after they have paid for the Carium platform. So obviously there is a tremendous revenue stream available to you, but that's not purely what this is about. Remote patient monitoring also provides better patient care to your patients because you're caring for them throughout their journey versus just caring for them, a couple times a year when they come into the office. It's also a way for you to build stronger relationships with your patients and ensure that they keep coming back to you, year after year. So in order to be successful with remote patient monitoring, you have to have the right tools. EMRs are great for episodic care and documenting when the patient comes into the office, but they don't provide you the necessary tools to care for your patients once they leave the four walls of your practice. That's where Carium comes in. We provide a collaborative care platform that allows you to care for your patients remotely and get paid for it. There are really two components that make up our platform. There's a mobile application that you provide to your patients. It can be run on any smart device, tablet. There's even a web-based version for the patients that still have flip phones. And then a cloud-based platform that you have at your practice to be able to capture information, see how the patients are adhering to the treatment plans that you've prescribed, and then most importantly, gives you the ability to intervene in real time when necessary, hopefully preventing a hospital readmit, an unnecessary ER visit or something worse. And as we've stated, if the patient is not engaged, nothing else matters when it comes to remote patient monitoring. And Carium is uniquely positioned to help because with us, it started with the patient. Our team of behavioral scientists, clinicians, and users have spent years developing a platform that would not only engage the patient, but engage them in a way that they would take some ownership in their own healthcare. But it really starts with these three pillars. The first is getting to know the patient as if they were walking in the four walls of your practice. Now, all patients are unique, and for us to be able to deliver personalized care, we have to understand their goals, what motivates them, and what specific things are going on in the world around them. We can do that through capturing biometric information from these devices, being able to capture nutritional information or sending out surveys to capture specific information about the patient. Once we know the patient, we have to be able to support them and support them on their unique journey. And as patients, we all consume information a little bit differently. So whether it's video visits directly to your patients or secure messages, educational material that's specific to what's going on with that patient, we provide that in a single platform. And then last and most importantly is the ability to provide a high-touch patient engagement strategy at scale through automation, knowing when to intervene and with what type of content. The result of this is what we like to call collaborative care, being able to have the patient and the provider using Carium together, resulting in better care, constant engagement that leads to better outcomes. In addition to providing the platform, we also help you with logistical support for these devices. So you can actually get these devices through your Henry Schein representative, or we can ship these devices directly to the patient's house. It comes in a nice kit with instructions, but I'll also show you when I go through the demo, the wizards that we've created to make it super simple for your patients to get onboarded with the devices. We obviously support and train your staff on how to utilize the platform, set up those automations that we talked about, and ensure that you're successful and prepared for the remote patient monitoring program. And then most importantly, we also help you with marketing support to your patients. So you can actually give us a list of your patients that you want to target. We will do outreach to those patients, educate them on what the program is, why you think they're a good fit for it, and actually help them get on to the platform. In addition to that, we provide the support for your patients. So if your patients have an issue with the app or one of the devices, they call Carium and it's one less burden on your practice. So we've spent a lot of time focusing on remote patient monitoring today, and I think that's where most of our customers are getting started with digital transformation. But one of the best things about Carium and what we created over 3.5 years ago is that we created a platform for virtual care. And what that means is a lot of our customers that start with remote patient monitoring quickly realize that there are other initiatives and other use cases that they can use our platform for. So things like chronic care management, diabetes prevention, behavioral health, to name a few, can all be run on a single platform, providing a single platform for you at the practice to manage your patients. And most importantly, a single application for your patients to manage all of their healthcare goals. We are honored to partner with some of the most patient-centric organizations in the country and have worked with organizations that range from one doctor practices all the way up to organizations like Seattle Children's, Atrium Health, to name a few. Just to call out one specifically, Pinellas Primary Care is actually one of our new customers that partnered with us. I think it's been 4 months now. And we just did a press release that we can make available to you that had tremendous outcomes. Obviously, a 43% monthly revenue increase in the first 5 months. We talked about the revenue and the reimbursement opportunity, but I think what stands out the most is an 89.2 patient engagement rate month over month, and a 97% of their patients say the new experience is a better one. Again, in healthcare, we typically don't get this type of engagement. I think if you talk to your EMR vendors that have patient portals, you'd be happy with a 10% patient engagement rate. So to see 89 and 97% is something that's really unheard of in healthcare and something that we're extremely proud of. So let me stop there and let me transition over to the solution demonstration so you can see what the platform looks like, both from a patient's perspective as well as what you would utilize at your practice. So as I mentioned during my presentation, there are two components that make up our platform. I'm going to start with the patient experience so you can see the platform and how your patients would engage and communicate with you. The first thing you're going to see before I even open up the application are these wizards that we've created. And it's really cool. It gives your patients the ability to kind of see how they're trending and how they're doing over time without even opening up the app. And again, it's important to note, we have these devices with us 99% of the time. So being able to nudge and remind them and get the patient engaged from their mobile device is extremely important. I'm going to go ahead and open up the platform here. The first thing that you're going to see is Mary is reminded to connect her device. So a couple things have already happened here. As soon as you sign up Mary to be a part of the remote patient monitoring program, there are going to be automations that automatically go out to Mary. The first is to get her device connected. So I'm going to go ahead and connect one of my devices. We've created wizards for a number of different Bluetooth and cellular enabled devices. In this case, we're going to use a blood pressure cuff. And you can see we provide a step-by-step tutorial on exactly how to get the blood pressure cuff set up. This is a one-time setup process. Once they get it set up, they're never going to have to do that again. The next time, they will just put the blood pressure cuff on their arm. The information is automatically uploaded and sent to their care team. The patient also has the ability to see and track how they're doing over time with these different biometrics. So if I go back to the health feed and continue on that automation and what has been sent to Mary as soon as she is enrolled in the program, another thing you'll see here is an RPM consent. So we send out a consent. It's a digital experience for the patient. And this is something that you can utilize for any of your surveys or intake forms. And again, it becomes a digital experience for the patient. She can go through and answer this, and the information gets sent back to her care team. There's also education material that went out. Again, Mary is a hypertension patient. We're tracking her blood pressure over time. So being able to automatically send education on blood pressure, you can do that, and it's not something you have to think about at the organization. It goes out automatically. And then the last thing I'll show you is the ability to prescribe actions. I think this is really important. We all go to the doctor, and the doctor tells us to eat better, exercise more. 75% of us probably go back and eat Whataburger on the way home. This is a way that you can actually prescribe better habits to your patients, and they can track it through their smart device. So for instance, we prescribe to walk 30 minutes 5 times a week. Mary can track this information, and we give them positive reinforcement and feedback throughout their journey. This information is also shared with the care team. So the next time they come visit, kind of what they've been up to, how they've been tracking against, treatment plans that you prescribe. And then the last thing I'll show here, and probably one of the most commonly used features, is our secure messaging capabilities. So very similar to a text message, except HIPAA compliant, they have the ability to communicate with you and your care team at the practice. There's obviously a lot more built into this, but for remote patient monitoring, I wanted to give you a high-level sense of how your patients would utilize the platform. So let me switch now to the care team platform and what you guys would utilize at your practice. The first thing that you're going to see as soon as you log in as a care manager or a health coach, a medical assistant, is a list of all your patients. You can sort these patients by a number of different things, an individual person, different programs, different care team members, but it gives you this holistic view of your patient population and how they were doing at a glance. So how are they doing towards those actions we prescribe? Are there any journals we need to take a look at or unread messages? It also shows you the last biometrics that have been received and the date that they've been received. Anything that is abnormal or shows up, an elevated blood pressure, is going to show up in this work list. So this becomes the work queue for your care team. You know, things like Mary just had an elevated blood pressure, or who are my patients that haven't sent in any type of reading in the past 7 days? These can all be tracked and start creating a work list for your care team. I'm going to take a look at Mary, see what's going on with her elevated blood pressure. As you can see, I have access to this information right from here. I also have access to all of her other pertinent information that we're tracking. From here, I can reach out to Mary with a message. Again, it goes directly to her smart device, or I can do a video visit directly from here. The cool thing about our video visits that are built in, it calls them directly on their smart device. So they don't have to go download a Zoom or some type of telehealth platform. It calls them similar to a FaceTime call that they're all accustomed to. Because Mary is enrolled in the RPM program, we also have a time tracker built in. So you can actually track the time that you spend with Mary. Again, that's one of the components for remote patient monitoring, is to spend that 20 minutes reviewing information and intervening when necessary. And then we track all of this information in the background. So we have these reports. We'll look at the remote patient monitoring report. This shows you all the patients that are participating in the program, how many are still outstanding to meet those 2 criteria. And then we actually give you a patient by patient list of how much time you spent with them, how many readings they've submitted, and exactly what CPT codes you can bill. This is something that can be downloaded and given to your billing manager or your third-party billing company, and they know exactly what patients and what CPT codes to bill for remote patient monitoring. So again, there's a lot more involved in the platform as well. Many other initiatives and programs can be managed on this single platform, but just wanted to give you a high-level overview of how we can help with remote patient monitoring. So I'm going to pause there, turn it back to Michael, and see what questions we have.
All right, hey, and Jeff, I think you're going to be coming back on the screen, and Justin, I think you're going to be moderating any questions. I don't know if we have any coming in, but I'd love for you to do that. For everyone who was able to watch, first and foremost, we do appreciate it. And I would say one of the key things that hopefully resonated with you all is that Carium has built, really an engagement platform, and that's the key. If the RPM platform doesn't have these engagement widgets and tools and things to increase engagement, you're not going to be able to hit all of the readings, and ultimately you're not going to be able to drive the 20 minutes. So I think that's really a main differentiator. So Justin, do we have any questions so far?
Sure, we do. And thanks, Jeff, for that presentation. That was terrific. A couple of questions. Could you walk through the onboarding process to get Carium up and running inside of practice?
Yeah, absolutely. Thanks, Justin. The process is pretty simple as it relates to remote patient monitoring. We typically get our customers from contract signing to them having patients on the platform inside of 3 weeks. And it can actually be done sooner than that, depending on which training program that you select. So we have a training program where we can break it up over a couple of days, or we can say, hey, let's break out, 8 to noon on a specific day and do our training then. So we have some flexibility, but this is not a long-term implementation process that we're accustomed to with, EMRs and analytics.
Great. The next question lends itself to that. So is there a steep learning curve regarding the Carium software?
There's really not. And of course, I'm paid to say great things, right? But I came from the EMR world, and most of our providers are accustomed to really having to learn technology. And it really, changes the way that they do business. This is simply a complement to what you guys are doing. It's a way to extend the service that you're already providing your patients to your patients once they leave your practice. And again, the learning curve, both from a clinical side of using our platform, is super simple. The same for your patients. I mean, we take every angle that we can to make it as easy as possible for your patients to be able to engage with you in this way, because similar to you, it's new for them as well.
Great. How do you suggest positioning RPM to patients? And then is there a training module for the patients to learn the app?
There are videos, and we obviously train your staff on how to properly onboard the patients. Again, contrary to most beliefs, even the population between 70 and 80 years old, I mean, they're using smart devices. I think the percent is somewhere in the neighborhood of 80-something% have a smart device. So I think we don't always give them the credit that they deserve, that they are using these technologies and apps today. So it's not as big of a learning curve as one might think. Justin, remind me, what was the first question? I took your second one first.
Yeah, just it said, how would you position or suggest positioning remote patient monitoring to a patient for the first time?
Thank you. Yeah, I mean, again, I would position it as this is an extension of the service that we're already providing, right? It's better patient care instead of you coming in a couple times a year, which is a disadvantage for the patient as well as the provider. The provider doesn't have the most up-to-date and accurate picture when the patient comes in every 3 to 4 months. This is a way for them to get that complete picture and be able to provide more educated, better care to their patients. So I don't see the patients pushing back much if it's positioned that way.
Great. And then lastly, Jeff, could you provide more detail on the educational sharing piece in the software? I think that they may be referring to what you showed regarding the blood pressure piece from I think the CDC.
Yeah. So we have a set of education that we provide out of the box to our customers, depending on the use case and how they're going to utilize it, whether it's hypertension, diabetes, whatever that might be. Most of our customers already have some type of content that we can upload into our platform and share digitally, right? We're not a content provider. We want to provide the best platform and allow people the flexibility to deliver, whatever content makes the most sense for them. So we do have some that comes out of the box, but most of our customers supplement that with the content that they already have.
Okay, a couple more came in. So is the $123 member per provider CMS reimbursed true for an FQHC? We are not reimbursed via fee schedule, but an encounter rate for face-to-face visits. If this is true for an FQHC, could you provide a link to CMS reimbursement? I have not been able to locate this.
Yeah, and that's always, why we always talk about Medicare, because it's across the board, it's the same amount. In each region, the reimbursement for both commercial and Medicaid are different, right? So you'll have to talk to whoever your billing person is for that. It's my understanding most of the FQHCs and community health centers that we've partnered with to date, and I think we've partnered with 7 in total, have been around a grant initiative for remote patient monitoring. So I don't know the answer to the billing component for FQHCs that are just trying to do this outside of a grant funded project. I would encourage them to look at the billing codes that we provide and talk to their billing person to see if that's something they could take advantage of.
Terrific. And then let's see, the patient has to submit 16 readings per month, or the physician?
Now, the patient would submit 16 readings in the 30-day period from that connected device, right? And then the physician office is required to spend 20 minutes reviewing, engaging, and interacting when necessary with that patient. So 16 readings come from the patient's connected device.
Okay. And then are there translation services available for non-English speaking patients?
We do have that for Spanish speaking patients today.
Great. And you may have touched on this, Jeff, earlier, but has Carium implemented their services within a federally qualified health center?
We have, absolutely. We have, like I said, we've in the past 4 months alone have partnered with 5 for the HRSA hypertension grant, most of which are Henry Schein customers.
Great. I think that was about it. So closing remarks, Jeff and Michael?
Yeah, I'll finish it on up. So first and foremost, Jeff, we can't thank you enough for spending your time with the group. For the attendees, thank you. Hopefully you were able to learn something. I know we're cutting the questions a little bit short, so if you do have any other questions, if you would like to learn more about remote patient monitoring or more specifically about the Carium platform, please reach out to your sales consultant or you can reach out to Jeff or myself directly. We can't thank you enough. Hopefully you'll attend some of our other webinars. We have another webinar coming up coming up shortly, and then there's another entire series called The Business of Medicine. So please look out for those advertisements for those webinars too. With that being said, I want to thank everyone and wish everyone a wonderful day. Take care.
Thanks, guys.